Lately, I shared a case of inner ear malformation, and I'd like to share my flow chart approach in video lectures. And I will start with the cochlear anatomy because understanding the inner ear malformation and cochlear anomalies requires quite good understanding of the cochlear anatomy. Here I will start by this video of normal cochlea because I want to show you two important structures which are very important for having the spiral shape of the cochlea, having the spiral configuration of the cochlea based on these two structures. The first structure is the interscalar septa. These are the bony septa separating the cochlear turns. Here we can see the bony septum separating the basal turn from the middle turn and bony septum separating the apical turn from the middle turn. Well-developed interscalar septa, this is the name of this bony septa, will keep on the configuration which is 2 turns and a half up to 2 turns and 3/4 of turns of cochlea, maintaining the configuration of spiral shape. The other structure, which is the modulus is the bony structure seen within the cochlear turns. Here we can see that line, bony spongiform bone within the cochlear basal turn. When we go upward, we can appreciate the presence of the modulus within the middle turn here and within the apical turn here. So we have the modulus inside the cochlea and the interscalar septum between the cochlear turns. The inner ear is formed of labyrinth and internal auditory canal. The labyrinth is formed of cochlea, vestibule, and semicircular canals. The otic capsule, which is the dense bone within the petrous part of temporal bone, forms the osseous labyrinth, which harbors the membranous labyrinth in cochlea, vestibule, and semicircular canals. The inner ear malformations responsible for sensory neural hearing loss, 80% involve the membranous labyrinth alone. At that time, CT and MRI has no role for diagnosis. Radiology has role of detection of 20% in case of otic capsule involvement by malformation of osseous and membranous labyrinth. The cochlear nerve, the cochlear anatomy is spiral-shaped 2.5 up to 2 3/4 of turns around the central core of modulus, as I mentioned, and the basal, middle, and apical turns are separated by the interscalar septi. As you can see here again, these are the bony septi between the turns. Again, you can see here the modulus within the basal turn. The well-development of these two structures will lead to normal cochlear configuration and size. The rest of development or underdevelopment or absence of either interscalar septa or modulus will lead to malformation for the cochlea. The mid-modular view, which shows the internal auditory canal entering the opening of the cochlea, which is called cochlear aperture, will lead to transmission of the cochlear nerve through the modulus to reach the organ of Corti, which is responsible for the hearing. So here again, we can see the modular view, mid-modular view. This is the mid-modular view showing the internal auditory canal entering the cochlear opening here, which is called cochlear aperture. See the modulus here, it will carry or transmit the cochlear nerve branches into the organ of Corti. The cochlear aperture anatomy, the bony cochlear nerve canal, you can call it bony cochlear nerve canal as well. It has a normal range of width, which is between 1.4 up to 3 millimeters. Less than 1.4 means there is hypoplasia. More than 3 millimeters means there is anomalous widening of the cochlear aperture as well. It transmits cochlear nerve from cochlea to the internal auditory canal. Measurement of this width should be done in the mid-modular view. The cochlear aperture is anomalous, it will be hypoplastic if less than 1.4, widened before more than 3 millimeters. This is the normal modulus here, but here it is narrowed. As you see here, it's like hairline canal. Here it is narrowed. It can be atretic, aplastic cochlear aperture aplasia by presence of bony septum interrupting the course of the canal. At that time, this is cochlear aperture aplasia. And this is what I wanted to tell you today in this lecture about the modulus and interscalary septa. And we'll see the underdevelopment, how it will affect the malformation of cochlea in the next lecture. Thank you for your attention.